Hi, everybody. This is Dr. Britt Talley Daniel, MD, a neurologist and headache doctor. And I'm talking today on a new subject. So I'm coming up to date. This is March 2020. New drug has been released by the FDA. And the question is, does Reyvow, Reyvow, which is generic name of SLMITIDA10, treat migraine? And I'm just going to use the name brand drug Reyvow now because the generic is not available. So, migraine is a complex neurovascular entity which is genetic. It affects about 25% of women and 6% of men. It is disabling and it can be either episodic or chronic in occurrence. 12% of the world's population have migraine. 4 out of 5 patients with migraine have severe pain during a migraine attack. And migraine has to do with serotonin metabolism in the brain, and drugs that activate serotonin provide treatment. So, this new drug, Reyvow, is classified as a serotonin 5-HT1F receptor agonist. And it's also been called in the trade industry a DITAN, D-I-T-A-N, because that's in the name of the generic drug. Now, an agonist is a chemical that binds the receptor and activates the receptor to produce a biologic response. So, Reyvow activates the release of serotonin, which helps migraine headache. So, the question for this discussion today would be, does Reyvow for migraine treat it? Yes, the FDA has released Reyvow, the first and only DITAN for the acute treatment of migraine with or without aura. And this drug is not indicated for the preventive treatment of migraine. It's just for acute therapy. So related questions would be, what is the site of activation? Well, this drug binds with high affinity to 5-HT1F receptors, which are in the migraine trigeminal nerve and the arteries in the brain. And it's believed to act in the brain centrally and peripherally. Well, what's the dosing? Well, the three different sizes of oral drugs, there's a 50, 100, and a 200 milligram drug. It's stated that the drug can be taken with or without food, but only one dose of Reyvow should be taken in 24 hours. A second dose is not thought to be effective for the same migraine attack either. And the safety of treating more than 4 migraine attacks in 30 days has not been established. So you only get 4 treatment days a month, it looks like. Well, what were the research trials that showed the effectiveness of Reyvow? Well, there are 2 trials. One of them is called Spartan and the other is Samurai. And the trials look at 2 different things. One was freedom of pain. The other one was called MBS. And MBS is an eponym which refers to migraine symptoms of photophobia, phonophobia, and nausea. So the trial results were for 50 milligram Reyvow for pain-free was 28% in 2 hours. In the Spartan study and the Samurai study, it was 15% at 2 hours. All going up to 200 milligram tablet for the Spartan trial was pain-free at 2 hours, whereas the 200 milligram was pain-free at 32%. And placebo had about a 21% effect in one trial and 15% in the other. So for the Spartan trial, 39% of patients achieved pain freedom at 2 hours for the 200 milligram dose. So it looks like the bigger dose you take, the better it's going to work, and that's true with most meds. But doctors generally want to start low, so probably we would start at 50 milligram dose and go to 100 and go to 200 to see how it goes with treatment. Next, we talk about MBS free pain. For the Spartan study, the 50 milligram tablet had a 49% MBS free pain freedom at 2 hours. Now, Samurai, they didn't really study the 50 milligram tablet. For the Spartan tablet for 100 milligram tablet, it was a 44% MBS freedom at 2 hours, and the Samurai group had a 41% freedom. And the 200 milligram tablet in the Spartan study was 41% MBS free, while the Samurai was 41%, where the placebo response in both trials was 33%. So it's a pretty big placebo response. They also gave a note on adverse reactions from the drug. And so they looked at placebo, they looked at 50, 100, 200 milligram dosing. And I have a blog article in this published on my webpage at drmigraine.com. You can see all the details. I'm not going to read all of this, but the symptoms they looked at were dizziness, fatigue, paresthesia, sedation, nausea, and vomiting, and weakness. And the most common and worst symptom looked like was dizziness, and that was worse at the 200 milligram dose, where 17% of patients had that. Okay, drug contraindications. It can lower the heart rate further if you give it to someone who has a heart-lowering drug, like persons maybe taking Inderal as a beta blocker for high blood pressure or heart condition. It can drop the blood pressure and the heart rate there, so you shouldn't use it in that situation. And it should also not be used with what are called PGP, breast cancer resistant protein substrates. Well, what's the use in specific populations? For pregnancy, there's no adequate data on the use of Reyvow in pregnant women. It may cause fetal harm study done on animal data, which is done in rats. Don't really have any human data on this yet. And for lactation, there's no data on the presence of Reyvow in breast milk. And consideration of side effects for using women for breastfeeding should be balanced with possible benefit from use. Severe hepatic impairment is a group of patients whom the drug should not be used. And there's no safety effectiveness data on pediatric patients at all. Geriatric use, dizziness occurred more commonly in persons over 65, and that related to a dose effect. So the higher dose, the more side effects you had. What about safety information? Well, a single dose of Reyvow may cause significant driving impairment due to increased sleepiness lasting as long as 8 hours. Therefore, because of this, patients are advised to not perform potentially hazardous activities requiring complete mental alertness, such as driving a motor vehicle or operating machinery, for at least 8 hours after each dose of Reyvow. The product information sheet stresses that patients who cannot follow this 8-hour non-driving recommendation shouldn't take the drug, and physicians who prescribe this are advised to stress this non-driving situation for 8 hours after dosing. Also, Reyvow is a Schedule 5 controlled substance. And on a study looking at human abuse potential of the drug, it gave higher what are called liking scores for Reyvow than placebo, indicating that it has an abuse potential. However, the amount of liking was less than for alprazolam, which is a class 4 narcotic benzodiazepine drug used for treating of anxiety. Feelings of euphoric mood and relaxation were reported with the use of Reyvow, but no physical withdrawal was observed in healthy subjects following abrupt cessation of the drug after 7 daily doses, so that was a short time thing. Warnings and precautions. Well, CNS depression. So the drug Reyvow may cause CNS symptoms, CNS depression, sedation, and dizziness, and should be used with caution with alcohol or other CNS depressants, like any of the benzodiazepine drugs like Xanax, Librium, or Ativan. There's also a report of a rare serotonin syndrome with the drug, and the serotonin syndrome includes symptoms of mental status changes, autonomic instability, neuromuscular signs, and our gastrointestinal signs and symptoms. Apparently, the serotonin syndrome symptoms were within minutes to hours after receiving a new or greater dose of the drug. One can also get medication overuse headache with this drug, which is a monster problem for headache doctors. And the number one reason that a patient goes see a headache doctor is 89% of patients there have medication overuse headache. And these are patients who have migraine or may not know they have migraine. They're overtreating with drugs more than 2 days a week, usually NSAIDs, Tylenol, Advil, triptans, or opiate narcotics such as hydrocodone or tramadol or butalbital. And the treatment of medication overuse headache is patient education and drug withdrawal. Please go to articles I have on that at www.drmigraine.com on that subject. Now, some comments I'm going to make myself. No one knows how it's going to play out, but it seems to me it's going to be a pretty limiting situation with this drug. You can't drive for 8 hours after you take it, because I personally take care of a lot of women who work in offices, and if they got a migraine at 3 o'clock in the afternoon, they couldn't take it because they want to drive home at 5. So it's going to be a very limiting situation. However, on the other side of this, the drug has a pretty good side effect profile. And we're always looking for another drug to treat, because triptans are the number one drug for acute therapy of migraine, drugs like sumatriptan or Imitrex. And something like 69 to 70% of patients get a 2-hour headache-free response with a triptan drug. and that's about twice to 2.5 times better than Reyvow can do for treatment of headache. And also, triptans can have side effects from patients with cardiovascular disease. The types of cardiovascular disease I'm speaking of here are angina, which is coronary artery disease, previous heart attack, stroke, TIA, out of sight hypertension has not been treated. So cardiovascular disease has a restriction for the use of triptans, and there's no direct statement on cardiovascular disease with this drug that's been done yet. But um, the drugs that activate CGRP in the past have been pretty friendly to heart issues, and some of those drugs work really well for it, like Aimovig has been studied and has no cardiac side effects long term, and that's a drug that blocks CGRP. So I'm generalizing there. I'm not accurate and it's not truthful, but I'm just guessing probably the drug is going to be safe for cardiac patients. We'll have to do studies to see that. But again, it will give patients who are non-triptan responders and patients who possibly have a cardiovascular disease a new way of treating. So it's in about dictation on this. Please click subscribe on your little button down there so we can stay in touch with each other. And God bless all you migrant patients. I'll see you again on another study. Bye-bye.